Hello everyone, my name is Dr. 𝗙𝗿𝗴 𝗂. I am a consultant gastroenterologist and hepatologist working at Mythri Hospital, 𝗙𝗂𝗃. Today I am going to talk to you about very important subject which is fatty liver. What is fatty liver? As the name explains, fatty liver is deposition of fat into liver. Normal healthy liver has less than 5% of fat content. But in fatty liver, the proportion of the fat in the liver increases beyond this normal limit of 5%. Why it is important to have a fatty liver or to understand more about fatty liver is that this fat deposition is not always healthy. It can lead to complications such as development of liver cirrhosis, liver failure and liver cancer. Today in India, almost 20% of population is suffering from some degree of fatty liver. Although everyone may not have consequences because of it, it is hard to predict who will develop liver complications because of fat deposition. So, what are the causes of fatty liver? Fatty liver is broadly categorized into two categories, like non-alcoholic fatty liver disease and alcoholic fatty liver disease. So, these are self-explanatory. Alcohol is one of the most important component of cause of fatty liver disease. So if you exclude alcohol, then all the rest of condition are labeled as non-alcoholic fatty liver disease. However, as the time has passed, the proportion of patients having fatty liver because of non-alcoholic causes have increased exponentially, and the reason for this increase is our lifestyle and changing food and diet habits. In India, according to certain surveys, in urban areas like cities, metro cities like Hyderabad, prevalence of fatty liver is up to 30%. So if you randomly pick up 100 people from the street and everyone is screened for fatty liver, almost 1/3 of patients will have fatty liver. So that's a sobering thought. So among non-alcoholic fatty liver disease, most important cause of fatty liver is being overweight, obese or having diabetes mellitus. So as you know, the pandemic of obesity is currently raging in India. Everyone is having fast-paced life, is not having time for dedicating to looking at weight management. So what are the consequences of having fatty liver disease? In certain proportion of people having excess deposition of fat in liver will go on to develop inflammation in the liver. The livers get swollen and it causes damage in the liver tissue, and this damage is usually not manifested. You don't feel it day to day, but this damage accumulates over the period of years, and once the damage is sufficiently large, it starts developing signs of liver failure, like having jaundice, getting accumulation of water in the stomach, having mental changes, even developing liver cancer. Problem is, in the early stages of fatty liver and fatty liver related complications, outwardly no one will have symptoms because of it, but once you have reached a critical damage, the failure starts, and by that time it's always most of the time too late. So it is important to understand that who are at risk of developing fatty liver, and they should be checked before they develop liver failure. So who are the people who should be aware about fatty liver disease? One, those who are overweight, that is BMI more than 22.5, and those who are obese, overtly obese, especially those who have fat around their stomach, belly fat, that's very important. And people who are having long-term diabetes, they should be screened for fatty liver disease, and if there are signs of liver damage, early interventions with the drugs or weight loss and diet changes can help prevent progression to liver failure. What are the how do we diagnose fatty liver disease? Fatty liver diagnosis is usually straightforward. It can be diagnosed based on an ultrasound. Ultrasound can give you a fairly good idea whether the how much degree of fat is there. Sometimes you need, but it will not give us idea how much the liver damage has happened. For that we have specialized investigations like liver biopsy or FibroScan, which will check the stiffness of liver. These tests are fairly easily available and easy to be done. So everyone who is diabetic, who is obese and overweight should be screened for fatty liver disease. And what are the treatments for fatty liver disease? Fatty liver disease cornerstone is weight loss and good diabetes control. Apart from that, in certain key populations where there are signs of progressive and rapid liver injury, you can give them certain medications which will prevent the progression of disease. I hope with this video I've been able to emphasize on you the importance of knowing fatty liver disease and its implications. Thank you.